This is Dr. Van Reken at Reno Sparks MedSpa, and I have Marie here who's consented to be a model for PRP. That's platelet-rich plasma. If you think about PRP, it's something many athletes have used in joints, and I gave some in joints earlier today in another lady. We do it in faces for wrinkles. We do it in necks for wrinkles. It's probably as good as anything, including lasers for neck wrinkles. It can be repeated. You're using the body's own growth factors, so we drew her blood earlier. We actually took it from her groin, and so we spin down the blood. We get some parts that are rich in plasma and rich in platelets. The platelets have growth factors, so we're cheating. We concentrate the growth factors, we inject them, and you get sort of skin repair, wrinkle repair, scar repair, and that sort of thing. So it's nice for necks because necks get old and loose. It's more of a problem in people that are thin. If somebody weighs 400 pounds, neck wrinkles aren't the big worry for most of them. And it's more of a problem with people with sun damage. So white, Caucasian type patients that have had a lot of sun need more wrinkle reduction than Michael Jordan. So without further ado, we'll go ahead and inject her neck and show you what it's all about. So Marie here has got some wrinkles under her chin, and we'll put a little product in here. You can see that will poof out a little bit. The major complication or side effect anyway is bruising. Most patients will bruise at least a little bit. You know, you're sticking them with a needle a bunch of times in an area with a lot of blood vessels and neck, so it certainly can happen. You try and avoid the big blood vessels. If you do hit them, they tend to bruise, but it isn't anything dangerous because you're just putting in blood products that you remove from the vessels anyway, and with a very small needle, so not a big deal. Notice that I'm going right here over a wrinkle, and I found out by doing my girlfriend that if you go right over a wrinkle, you go this way, you tend to improve the wrinkle wherever the plasma hit it, but in other areas not so much. So I like to go right along wrinkles when I can find them, and then I think you get a really nice cosmetic result. How much does this hurt if 10 is horrible and 1 is just a wee bit?
I would say 2.
So not too bad.
No, not bad at all.
Okay.
It's just like getting a shot.
All right. And so far we've been lucky. She hasn't bruised at all. And once again, I'm sort of near the jugular vein here, but trying not to get inside of it. You doing okay?
Mm-hmm.
And then the area of the ear, underneath the ear and posterior to the ear, is kind of an area that tends to wrinkle, sort of near that mastoid bone. So here I am. You can see what I'm talking about here. And if you really want to make somebody look younger, you ought to pay a little bit of attention to this area.
Last one, doctor.
So that side is done. And if you look, we maybe have a little bruise here, but overall not much bruising from this procedure, at least in her case. And so I'm going to repeat this on the other side. So probably about 80 or 90% of the patients get benefit from this procedure in my experience. The necks are pretty satisfying. Most people, even within 2 or 3 weeks, are noticing decreased wrinkles and so forth. And if somebody doesn't notice much of improvement and you look at their pre and post pictures, you can usually pick it out. Some people are more observant than others, but most people get a nice improvement. It is not unusual to take 5 or 10 years off the appearance of a neck with one treatment, and maybe go to 10 or 15 years sometimes with 2 treatments in some patients. So this is Dr. Van Reken signing off for Reno Sparks MedSpa, and remember to always seek competent medical advice if you're having any procedure, small or large. Thanks, have a nice day.